Welcome, everyone. I hope you can hear me. And welcome to our last event of this series, actually. I'll talk a bit more about that later. And today we will discuss livestock health under One Health. And as always, I will introduce the topic a bit first before the speakers. It takes a bit of time to load the next slide, but it is working. Yes. So for livestock production, it significantly contributes to the livelihood of people in both high and low income countries. And there's also an increasing need for animal products to feed the global population. And on the other hand, the sector is also responsible for the emergence and spread of infectious diseases, which have the potential to severely impact both animal and human health. And as we've probably all seen by now, that can cause significant societal disruption and economic loss. Oh, sorry. So we have this potential for infectious disease that I just mentioned, and also healthy livestock is more productive. They require fewer inputs such as food and, of course, also less medicine. So the current practices are also associated with environmental degradation and deforestation, biodiversity loss, climate change impacts, in also all countries across the income levels. And then we come again to this overarching theme, of course, that we have in all these sessions, the One Health approach. And for now, the balance between these components, so the human health, environmental health, and animal health seems to be a bit off. And then how do we move to improving the sector and improving livestock management systems? So for now, surveillance systems are deficient in many low-income countries. In these areas, the populations are in close contact with both domestic and wild animals. The land use in these regions is changing quickly, so it's important to implement and strengthen disease surveillance systems there in these low-income regions. And then also the contact of humans or animals with pathogens is best prevented by the use of livestock vaccinations and also other disease management techniques. So increasing the use of livestock vaccinations then prevents the need for antibiotics as well. So in that way, it also prevents microorganisms from building this resistance against antibiotics. And lastly, it's important to not just provide large-scale farmers, but also small-scale farmers with the necessary knowledge and skills, so both men and women, to protect their livestock's health. This includes the access to health and nutrition, like the information and agricultural extension services, better food, and also environmental and animal health services. And today the speakers will be discussing their perspectives on the crucial role of livestock production and the practical application of One Health in animal health. And things we will discuss are the relationship between drivers of intensification, trade, climate change, and livestock production systems, and their overall impact on public health. And on the other hand, we will also discuss the key drivers of change that affect livestock systems and their impact on sustainability and resilience in case of future outbreaks of diseases. So today we will start, with me introducing the event. Then Aamir Muse Osman will talk about One Health and livestock health based on his PhD. After which Dr. Fairouz Larfaoui will discuss One Health in agri-food systems, and Dr. Felix Njeumi will discuss the PPR and food security from a One Health perspective. Then we have a break with some interactive components there as well. And we will have a large interactive panel discussions with the audience and the speakers, where there's also the integrated Q&A. So there's also room for questions there. So please write them down during the presentations. And then just to give some information about the speakers, Aamir is trained in veterinary medicine and One Health, and he's currently a PhD candidate in that area. He's also the director of the Somalia One Health Center at Aamir University and the One Health officer at the Ministry of Livestock, Forestry and Range in Somalia. He is now also a finalist of the 2024 World Food Forum Transformative Research Challenge of the Global One Health Prize. So he's from the cohort after our target audience, actually from the 2023 cohort from the same prize. Then our second speaker, Fairouz, she is a veterinarian by training, and she coordinates the quadripartite of the Food and Agriculture Organization, the United Nations Environment Program, the World Health Organization, and the World Organization for Animal Health. She's currently working on One Health and zoonosis, and One Health and agri-food systems will then be the focus of her talk. And she will be substituted by her FAO colleague, Marion Selos, during the panel discussion. And I will introduce her shortly as well, just to give some background of who we're discussing the ideas with. So Marion, she's the One Health officer at FAO, and she supports this quadripartite secretary for One Health that I just discussed. And she contributes to coordinating and finalizing the One Health joint plan of action. And then Felix, he is widely recognized for his contribution to rinderpest eradication. And he's now the coordinator of the FAO and World Organization for Animal Health joint secretary for the peste de petit ruminant. So based on his knowledge of the rinderpest, he's now part of this global eradication program, the GEP. And he will talk more about this PPR disease from a One Health perspective later in the session. I hope you enjoy it a lot. I see Aamir just entered our event, so I will give him a bit of time to put up his presentation as well. Hi, Aamir. Are you ready to present?
Yes, thank you.
Okay.
Do you hear me well?
Yes.
Thank you. Do you see my screen now?
Yes.
Yep. Thank you, and good afternoon and good morning, everybody. It's my pleasure to join you this afternoon to present this presentation, Livestock Health under One Health. If I will start, I am Aamir, as my colleague mentioned it. So I am a PhD student as well as a director of Somalia One Health Center. So I will talk a little bit about our center and what we do. It's called Somalia One Health Center of Aamir University. It's a center of excellence who dedicated in healthcare of human, animal, plant, and their shared environment through collaborative and a multisectoral and a transdisciplinary approach under One Health. So its focus mostly spans on education, research, and as well as some outreach programs that contribute significantly to the field of One Health. And the center also organizes a biannual conference. So every 2 years, having successfully held 2 conferences that brought together global participants, including renowned experts. The conference also had a honor to receive the president of Somalia. Through this initiative, the center achieved notable milestones such as empowering individuals globally, fostering faculty development, and expanding international reach, driving impactful research and advocate education. More recently, we have also organized an event called Youth One Health talk, where we successfully held 2 different sessions, and the last one was yesterday, and we have more 4 to go before the end of this year. This is all about our center. And when it comes to our team, we have been selected the finalists for the prestigious Transformative Research Challenge, Global One Health Prize by the World Food Forum. We are a team from multidisciplinary, multinational, just to have an idea and to have different groups to bring to the table an innovative approach. And the aim of our project is to address vulnerability through a mobile app for early disease reporting, including educational content to raise awareness about Rift Valley fever prevention, and as well as self-care practice and suitable lab making diagnosis faster, just to protect the next pandemic. So the outline of this just presentation today is I will start talking about some introduction. Later, I will talk about animal health under One Health. So when it comes to animal health, zoonotic disease comes first to our mind, and as well as antimicrobial resistance and way forward. When it comes to One Health, it's not a new, but it has become more important in recent years during like pandemics. So this is because many factors have changed interaction between people, animal, plants, and the environment. So the One Health calls for a holistic system based on approach that recognizes the interconnection between the health of human, animal, plant, and the environment. When it comes to the definition of One Health, there is no universal accepted definition that all people use, but this is the most recent definition that One Health high-level expert panel proposed, and it says that it's an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystem. It also recognizes the health of human, domestic, and wild animal, plant, and the wider environment, including ecosystem, are closely linked and interdependent. But it is important to note originally, okay, there was what called tripartite collaboration, which are Food and Agricultural Organization, World Health Organization, and as well as World Organization for Animal Health. So at that time, there was a definition that proposed at that time. If you can read the definition carefully, so you will see that absence of explicit reference to plant and ecosystem is the most highlighted one here. And if you go back to the recent, the latest definition that One Health high level proposed, they bring to the table plant and ecosystem. And as well as now they are quadripartite, and they bring to the table to the United Nations Environmental Program, UNEP. So this all shows that this One Health concept is still naive and still are growing and gaining broader attention. So when it comes to talk about One Health history, so let's go back to the 18th century. Dr. Rodolphe Virchow, he's coined the term zoonosis and emphasized the link between human and veterinary medicine. So he has a well-known book that collects the relationship between man and the animal. So in the history said that he was the first one to talk about that linkage between animal and the human. Later, Dr. William Osler, he was also a student of Dr. Virchow, and he also known father of veterinary pathology in North America. Father explored this connection between human and animal. And Dr. Calvin, as well as he was advanced veterinary epidemiology with his work on zoonotic disease. He also part of this journey when it comes to One Health. But the Wildlife Conservation Society in Manhattan principles laid the society or laid the foundation of the modern One Health concept, advocating interdisciplinary collaboration. So since that time, 19th century, numerous milestones start from Virchow to the time of zoonotic and to present day in 2004. One Health conference have contributed evaluation of One Health concept. So at that time, veterinarians have historically been the forefront of this movement, actively collaborating human medical professionals and the disciplines. So if you take a look, these two papers that I put here, and I will share the link later, so you will see that how they will talk about how veterinarians are forefront while they are doing some qualitative and as well as some cross-sectional studies. Okay, so the livestock sector is a pillar of the global food system in contributing to poverty reduction, food security, and agricultural development. According to the FAO, Food Agriculture Organization, livestock contributes around 40% of global value of agricultural output and supports the livelihood and food nutrition security almost 1 billion plus people. So animals provide many benefits to people. First, they are essential to our ecosystem balance, the environment that we live, and as well as animals are interact with our daily lives, both home and away from home. They use our transportation, drought power as a fuel, clothing, and protein source when it comes to food. And for animal byproducts, manure, we use as a fertilizer, and they are also a comfort and mental health and cultural identity from different people around the world. So when we talk about animal health or animal, SDG comes to our mind as the Sustainable Development Goals. I believe most of you have aware that this is like, call it Sustainable Development Goals launched by the United Nations in 2015, where global challenge calling for poverty ending, education, environmental protection, peace, and prosperity among 17 main goals. And the main objective of this is leave no one behind. And there are many studies that talk about how animal health contribute to achieve SDG goals. But there are two studies that I end up reading while I am doing some literature. And these two papers, what they mention is animal health and welfare may be indirectly accomplished in the most SDGs, not directly, as improvement for human life. So despite being highlighted a comprehensive, this agenda has raised three major concerns for One Health, animal rights, and protection. The first that they mention is the lack of independent animal health SDG. If you see all 17, there is no specific one that talk about animal health. And they also mentioned that animal were mentioned only once in the full document. The third one that they mentioned is sustainability index have historically failed to animal health. So that's some gaps that SDG had when it comes to animal health, but they indirectly talk about how animals contribute just for the matter of improvement of human life. Okay, animal health and world health. There is a critical connection between animal health and the global public health. So as we can see, a significant portion of human disease, 60%, originate from domestic animals or wildlife. Emerging infectious disease are even greater concern, with 75% of these new pathogens coming from animals. In fact, 3 out of 5 new human diseases that appears each year are linked to animals. Moreover, 80% of disease of bioterrorism potential, such as anthrax and plague and etc., are zoonotic, meaning that they can be transmitted between animals and the human. So as both human and animal population grow, in their interaction increase, so the risk of disease transmission also increase. This underscores the need of One Health approach, where human, animal, and environmental health are addressed together and to mitigate the ground risk. A large scale of outbreak infectious disease, also known as pandemic, have caused significant loss of human life along with the economic and social issue. There have been several zoonotic pandemics outbreaks which have caused morbidity and mortality over the wide geographical region since recorded history. Scientific data and research have pointed that the frequent emergence of novel zoonotic disease has deep linkage to the changing global environment. Key reasons related to this emergence are transmission of novel zoonotic pathogens to humans include destruction of natural habitat of wild animals, possibly reservoir of novel human pathogens, and increased man-animal conflict, global warming, climate change, as well as pollution. When it comes to zoonotic disease, there are many challenges. So it's crucial to understand the challenges they present. So here we discussed just three the challenges. The first one is the transmission route. Zoonotic disease can spread through various means, including direct contact with animal, infected animal or sick animal, airborne particles, contaminated food and water, and through insect vectors like tick, tsetse fly, mosquitoes. So understanding this route is essential to effective prevention and control. So, and this also zoonotic disease bring to global impact on global health, leading a wide spread of illness, death, and significant economic losses. So zoonotic disease can also trigger outbreak and even pandemic, emphasizing the need of global attention. When it comes to prevention and control, addressing zoonotic disease, it requires a comprehensive and also a multi-sectoral approach. These include implementation of surveillance system to monitor disease spread, vaccination at risk populations, enforcing biosecurity measures, and educating the public on preventive practices. So all these needs is to collaborate across sectors from different domains of One Health, including plant, animal, human, and environment. And that's also essential to mitigate the risk that may arise zoonotic diseases. So when it comes to disease, AMR, or I mean antibiotic, comes to our mind. Just let's treat the animal. So what if the treatment become a problem? Antimicrobial resistance in livestock is a growing global health concern. So number one, overuse of antibiotics. Excessive and improper use of antibiotics to the livestock contribute to the rise of AMR problem. The overuse accelerates the development of resistance bacteria or another pathogens, viral as well as fungal, which poses a significant threat both animal and human health. So the resistance mechanism or the gene can evolve to resist of antibiotics, enabling them and survive and proliferate even if the presence of these drugs. This makes infection increasingly difficult to treat and control, and that also cause loss of animals and as well as many human lives. So that also lead to many consequences to human health. The resistance developed livestock can transfer to human, often through the food chain or direct contact. This leads to infections that are harder to treat with the potential fatal outcome, highlighting the interconnectedness of animal, human health under the One Health approach. So animals become one of the biggest drivers of climate change, and environmental distress. Animal farm create a staggering amount of air, water, and land pollution, with the consequence of climate change worsening by the year. Addressing the environmental impact on livestock farming is more important than ever. So greenhouse gas emission. When it comes to livestock, especially cattle, are a major contributor of greenhouse gas emission, and such as methane, which is significantly contribute to the climate change. The land use. So livestock farming requires large tract on land grazing and feed production that often lead at some point deforestation. They also lead water pollution. When it comes to improper management of livestock, waste can result to contamination of water, which also risk both human and as well as the environment. Biodiversity loss. Intensive livestock farming practice can degrade habitat, leading to fragmentation and reduction of biodiversity, especially in area of high livestock density. So transforming our food system and consumption habit, it's undeniable solution that must be part of global roadmap of addressing the climate change. So before the end of this, I just want to highlight this point, which is ethical consideration implementing One Health practice. So it's a bifocal to this collaborative approach continues to evolve. The integration of human, animal, and environmental health and plant health sectors raises complex ethical challenge that must be addressed to ensure equitable and effective outcome. These include concerns about animal welfare, the fair distribution of resources, and the right of community affected by the One Health intervention. The instance, prioritizing human health over animal and other domains can lead some ethical dilemmas. So thank you. That's all of my presentation.
Yes, thank you for your presentation, Aamir. I really enjoyed it. Thank you for providing the overview of livestock health in One Health, and also, very solid conclusions. So I look forward to hear more also about your project, about the Rift Valley fever and the mobile app for disease reporting during the discussion. I hope everyone wrote their questions down. I did. So let's go to the next speaker. Fairouz, are you ready?
Thank you. Thank you. Just a second, I will share my... Do you see my presentation?
Yeah, I can see the presentation, yes.
Okay, in full screen?
I see the presenter view now.
Do you see with the notes or just...
Yeah, with the notes, yeah.
Okay, just a second then. And now? How do you see it?
I now just see the start screen of PowerPoint, but it could work if I see the next.
It's not full screen?
No, maybe you have to put the full screen.
Okay, just I will stop sharing and put the full screen first.
Yeah.
Okay, sorry, excuse me.
No problem, yeah.
Brilliant.
It's every app has different requirements, so yeah.
Just a second.
It's working right now.
Now, how do you see it?
Yeah, this is perfect. Yeah.
Okay, thank you so much. So good afternoon, everyone, and thank you very much for the invitation, for inviting FAO and to participate to this event on One Health. So my presentation will be on One Health work in the agri-food system transformation. And I will give you a bit an overview on FAO vision on One Health, and also bringing some concrete examples of One Health applications also in the fields and with some specific programs. So first, before starting, I would like to highlight and to bring to your attention some challenges that we are facing along the agri-food system. So we know that the world has been focused on driving productivity to meet the increasing food security needs of a growing world population. And we could say that today over 9 billion people can be fed with the amount of calories produced today. However, we are still facing a number of challenges, and starting with the fact that there are some environmental stress increasing globally, and this was also before mentioned by my colleague Osman in the previous presentation. In fact, that about mentioning the issues of the global global greenhouse emissions. For example, this is 23% attributed to the food system. We also would like to mention the fact that 75% of land substantially degraded, with significant contribution from agriculture. We have also an important impact on the security of future supply that are in question. 50% of food insecure nations are experiencing lower crop production. We are also over 75% of food comes from 4 major crops, are major concentration risk. Also, we have a challenge of hunger and poverty challenges that are still prevalent. Now, I'm not going to bring all this number because I don't have so much time, but just for you, you will have this number in the presentation that we will share with you. There is also the challenge of the food that is produced and that is contributing to a global health crisis. Here mentioning that over 2 billion of people lack still of micronutrients. So this is just to bring you a bit to your attention some background information and some numbers before going a bit more deeper into the presentation. So now highlighting in FAO, I would like to highlight the fact that we have 20 priority programs in FAO. And one of the 20 priority programs is the one on One Health. And this program really consists in strengthening and better performing national and international integrated One Health system for human, animal, plant, and environmental health, achieved through improved pest and disease prevention, early warning, and management of national and global health risk, including AMR. So you can see on the screen these 5 important pillars and the importance of really having a cross-cutting approach along these different pillars. So one is an improved early warning system. Second is a better biosecurity system for pest and disease management. Third is a more effective emergency preparedness and response. Fourth, heightened AMR risk management. And lastly, enhanced One Health system with the integration of the environment. And these are really some of the very important pillars of our program. Now, what was interesting, the One Health definition that I want to bring to your attention, this was done by the previous presentation by my colleague. So I think I will not go into detail, but I can say and confirm what was said before on the fact that it is a very inclusive definition. It was developed, as it is mentioned here, by the One Health high-level expert panel, which is an advisory board of the quadripartite alliance, which are these 4 organizations that was also mentioned before: FAO, UNEP, WHO, and WOHA. And we can say that this definition is today probably the most inclusive one we have, and especially for FAO, we can say that is really covering also important aspects related to the water, energy and air, safe, nutritious food, climate change, and so on. So I will move to the next slide, but really to emphasize the importance of this One Health definition. And also to highlight what in FAO we consider really very key elements on One Health that really which is very important to have a collective effort to the to support the implementation of One Health. And this through these different key elements that are here mentioned, the cross-sectoral technical support and coordination. The One Health assessment is something very important, also using tools that exist to perform this work. Data evidence and knowledge for capacity on One Health. Importantly, also at national level, the governance, policies, legislation, and finance, which is important at country level, but also at international level, and so on. Communication and advocacy for One Health, this is extremely important. Partnership and leveraging investment. Systems and tools I mentioned, having, and I will give you some examples later on, sorry, and prevention, preparedness, and response, and finally, the development of national One Health strategy and action plan. These are really these key elements really to address One Health. Now, also to bring to your attention here, it is a framework that was developed by the 4 organizations I mentioned before, the quadripartite. So this is where FAO actually is very much engaged with partners in upstreaming One Health. And in this case, I want to highlight this One Health Joint Plan of Action. So this was developed by the 4 organizations with a huge technical team from the different organizations. Also, the the countries, member state of the organization have contributed also to this work and providing input. And this is a very useful framework that really it really outlines not first of all the commitment of the 4 organizations in working together in advancing One Health, but it has also the importance of this action plan, that it is built around 6 interdependent action tracks. I'm not going too much into details, but important for you to see that these action tracks that you see on the left hand of the screen contribute to achieve sustainable health and food systems, reducing the global health threats, and to improve ecosystem management. And important, the interconnectedness between all these action tracks, which are, as you can see, the first one is really to enhance One Health capacities to strengthen health systems. The second one is on reducing the risk of emerging and re-emerging zoonotic epidemic and pandemics. And the number 3 is in controlling and eliminating zoonotic, neglected, tropical neglecting and vector-borne disease. Action track consists in strengthening the assessment, management, and communication on food safety risk. And the action track 5 in curbing the silent pandemic on antimicrobial resistance. And lastly, the last one is to integrate the environment into One Health. And here, what I would like to highlight, seeing all these action tracks, actually, it's a different organization, and we all work on all these action tracks, but the idea is really to have more interconnectedness among all these activities, action tracks, sorry. I did not go, into details on the fact that there were also a theory of change, that was developed, and which is oriented into 3 important components that is key for advancing One Health. One is a governance and policy, legislation, financing and advocacy. Second one consists in the organizational development and implementation and sectoral integration. And the last one is on data, evidence, and knowledge exchange. This allows really to have a world better able to prevent, predict, and detect and respond to health threats. Now, just to highlight quickly some programs that are important in FAO and allow really to support advancing One Health into, of course, the livestock sector specifically. And I want to mention here the Emergency Prevention System program. We have also still in a partnership component, the GFTAD, which is also a global framework for the progressive control of transboundary animal disease. It's between FAO and WOHA. These are all, and this really allow for a better coordination also mechanism to address diseases, such as also you will see later on by my colleagues, Felix Njeumi, the PPR, Peste des Petits Ruminants program, for example, that will be described later on. And these programs, of course, these areas of work are strengthening national and global early warning system, working on policy strategy for high impact diseases, working on national supporting countries in developing the national biosecurity system. It's a focus on science and research networks, on capacity building and knowledge sharing, and of course on global and regional coordination for prevention and control of diseases. Here is just to show you also how much, I mean, we are engaged in the field at country level, because of course FAO, we don't go into detail how FAO is structured, because we have been informed that you are quite familiar with this organization, but we have, of course, headquarters, which is in Rome, but we have country offices, and we have different programs related to in strengthening animal health and One Health systems and capabilities. We have which are covering over 70 countries, and we have also FAO offices present in 130 countries. And experts also allocated not also at country level, in also some regional offices in FAO. And we have, I would like to mention some program also like the ECTAD, Emergency Center for Transboundary Animal Diseases, for example, as you can see in the map. And this really allow to work really very at country level. Here, I heard before this important prize received that was mentioned by Osman, Aamir Osman, in terms of reporting system. And I want to bring to your attention how FAO is very much engaged in these activities. And this is a mobile application that is used by the veterinary services to report in real time animal disease threats. This is the added value of this system. It allows to collect data online and so on, to send through a network and share this information. As we said, the data sharing is so important at national, regional, and global level. But in this case, it's really to ensure that the information reach out to the decision makers, which are of course, in the livestock sector, the decision maker from the livestock sector, but also sharing information with the public health sector, which is absolutely very important. And in fact, FAO is supporting the veterinary services in the use of these tools and in the improvement of this tool, and in ensuring that these tools have also are adopting a One Health approach. Here, this is another very interesting also activity program. It's on AMR in agri-food system. And here we also to share with you that FAO has actually supported 70 countries in developing their action plan. So antimicrobial resistance, as we know, it's an important, how do we say, fear for the livestock production. So it's and FAO it's put in a very high level agenda, I mean, to address AMR. And just to bring to your attention that tools for laboratories assessment and AMR surveillance has been also developed, and 55 countries have been supported on this, and there were also assessment conducted in over 300 laboratories. We have also reference centers for AMR that we collaborated with. Also to mention the progressive management pathway for AMR that has been assisting 40 countries to strengthen the food and agriculture component of the National Action Plan. Also, we are engaged in FAO and working also in strengthening legislation on One Health, for AMR, and 30 countries have been supported so far. And lastly, I would like to highlight the fact that what is also important is the fact that having support also in funding support to implement activities at country level. And this is, for example, the case of AMR. We have a multi-partner trust fund that allowed to support 16 countries and 4 global programs. So this is just to give a bit of flavor of some activities that we are involved. There is much more to share, but it was just to give you some examples here. And I would like to conclude my presentation saying that in FAO we have an internship and volunteer program that allow you to gain an experience also in FAO, and here you have all the explanation on how to apply if there is any interest from your side. There are 2 different. One is an internship program for students enroll in a undergraduate or postgraduate degree, or recently graduate and who wants to have this opportunity to join FAO for a period of time. And then also a volunteer program, which is a bit different. And in case you want more information on that, you can contact me or access directly also to the website where there are some regular call of expression of interest. You have to compile the information, and then in case of your interest, again, do not hesitate to contact me. So I will end here with my presentation, and also here you can see we have a One Health website as well, where you can also find a lot of information regarding our activities in FAO, in the animal health sector and the other sector to address One Health. Again, thank you.
Yes, thank you for providing the overview and for discussing the projects and also discussing these opportunities within FAO for our participants. And it was interesting to hear about the Joint Action Plan and other projects that you are involved in to implement the One Health approach and also increase this interconnectedness between the components. So I'm enthusiastic about discussing how these projects can help prevent diseases from spreading, not only from livestock and other animals to humans, but also the other way around. So how we impact animal health as well. I'm looking forward to that. And now we go to our last speaker. Felix, are you ready? Oh, presentation is already on. Great.
Yes, I am trying to you have it in full screen, isn't it?
Yeah, it is.
Okay. In any case, Fairouz, my neighbor, maybe you may be hearing her voice. She's moving for another meeting. But she already gave really more the background of what I will be discussing. More importantly, maybe she finished with the volunteer program, with the internship program. In my team, I have two intern. I am sure that she will have time to present herself. It means that you already have somebody who can assist you, maybe how to become intern after your period of mentorship with Veterinarian University. In addition to that, PPR was the pioneer for this transformative research challenge. We were the first one in 2022 to give the grant to students, but the grant is on peste de petits ruminants. I was requested to prepare to share with the participants what is this PPR, but in the framework of the food security or maybe One Health perspective. But before starting, maybe I will try maybe to have the first question, or maybe to answer the first question. We're talking about PPR. What is this PPR? PPR is the peste de petits ruminants. It's a disease of small ruminants. Small ruminants are sheep and goats. But when it enters in the flock, 30 to 90% of herd could die. Therefore, mortality can reach up to 90%. But in young stock, we can have even for up to 40%. Currently, 70 countries around the world are infected, from Senegal to Mongolia, China. But this disease spread by direct contact or when animals they mix. There's no carrier state, but immunity is good after recovery. It means that in the history, we have never got any animal who get infected. If it not die, that animal have immunity for life, therefore will not be reinfected again. The disease moves through maybe transhumance, through pastoralism or agro-pastoralism. It could also move through illegal trade of animal, vehicle, or undeclared country status. Conflict can also be maybe the reason of this animal moving, but climate shock as well, increased migration. But more importantly, and you will see in my left side, my right side, one of the first one that, or maybe lesson learned, something that at least take home message is that PPR has impact in the wildlife community, therefore in biodiversity. Example, when there were first outbreak of PPR in Mongolia, almost 60% of the endangered saiga population died. It means that in terms of biodiversity, saiga is the population that is almost close to extinction, but 60% of this animal die after the outbreak of PPR. Therefore, as I was saying, the first take-home message is its impact in biodiversity. But in any case, likely it is in wildlife. Wildlife is a spillover, may be infected but not develop the disease. But other species, not maybe saiga, but other small ruminant wildlife population could be affected. But we have been also discovered seropositivity in atypical species, such as camel, pig, and others. But in the introduction, I was presented as maybe coming from ringleaders. It's true that one of the success story of the vet science is the eradication of ringleaders. That was declared eradicated in 2011 here in Rome. But when eradicating the disease, declaring the eradication of ringleaders, member country requested to use the lesson learned from the eradication of ringleaders and apply it to other disease control. Therefore, we start thinking about next disease to be eradicated, peste de petit ruminant. And we start preparing the strategy. This strategy has 3 components. Therefore, when we are talking about PPR Global Eradication Program, it's not only PPR itself. Its first objective is to eradicate PPR, but when eradicating PPR, we have to reinforce the services. But more importantly, we need to make sure that we reduce the impact of other small ruminant diseases. And I do remember the first presentation where my colleague from Somalia mentioned about Rift fever. We will come on it later. But in any case, the disease is, we are planning toward the eradication of the disease in 2030. Like the first presenter was saying, the eradication of PPR is contributing also to SDG, but linking to food security, One Health, it improve livelihood, food and nutritional security, well-being, and resilient or livestock-dependent community while protecting biodiversity. The first phase of the program runs from 2017 to 2021, and then now we are in the second phase of the program. I was saying, during the first phase of the program, we try to identify from each region around the world what will be the disease that they will be combining, because the third objective of the program is to control other small ruminant diseases. Therefore, in this slide, you see that there are many other zoonotic diseases that they will be combining with PPR, namely brucellosis, Rivale fever, among others. Therefore, you see, we are already in the framework, even in the objective, the treated objective of the, if we are looking the One Health in term, only in terms of zoonotic diseases, the PPR program is already addressing also One Health in terms of disease. How are we able to decrease the prevalence of brucellosis? How are we able to decrease the prevalence of Rivale fever when eradicating PPR? But small ruminants are the business and livelihood of primary women. Therefore, when we are talking, One Health is also how we interact, the connectivity. But if you look the photo in the right side, it's these children whose life in the morning rely on milk. Without milk, these children maybe will go through malnutrition. And this is one of the parameters that Fairouz just mentioned. It means that when looking the One Health, we have also to look in terms of nutrition. They provide not only any outbreak of PPR will maybe decrease the quantity of milk, therefore leading to malnutrition, not only for children, but also to all of us. But in many areas around the world where we have small ruminant is cared or by youth or by women. Therefore, when controlling PPR or eradicating PPR or other small ruminant diseases, we are also mainstreaming women, gender, into the livestock sector. And for many regions, when women, they have control of PPR, it is their bank account. Why their bank account? Because anytime when they want to send their kid at school or they want to bring their kid in the hospital, they will take one goat, go and sell it, and you have money to bring their children at school, to pay the school fee, or to pay any other expenses of the expenditure of the household. But it could also be used in terms of manure for fertilization rather than chemical. You see more or less how small ruminant is used also for fertilization. Sale of kit for feast day celebration provide cash for women. This is what I just mentioned. Women overwhelmingly reinvest their income into their children for food, education, and clothing. In event of a political or climate crisis, animals may be sold or taken with them. Therefore, when we are talking about migration, they migrate with their small ruminant because it is really easier to bring your small ruminant with you compared to cattle or camel. Goat in particular provide an income or consumption buffer against substantive drought shock. Then this quote is another thing that maybe I think take home message. What we had in one Maasai lady in the Horn of Africa. She said, when my last goat died, I had lost everything. This then is poverty. It means that for her, poverty is when she don't have goat anymore, goat or sheep anymore. It means no milk, children will be fed carbohydrate instead. Her children development, no income for kids sale or cannot afford to purchase items for children, family, disrupt cultural and religious practices, cut down trees for firewood and charcoal, migrate from rural area, as I was saying, to the city, then add in climate shock such as drought. In general, in 2015, when launching the strategy, we also thought that they will also need to maybe assess what is the socioeconomic impact of the disease. And it was estimated that almost 1.4 to 2.1 billion are lost annually due to the outbreak of PPR. But this does not include the cost of human suffering from loss of livestock. But to address PPR, we have been divided. We have almost 400 to 500 experts around the world, and they are divided in 5 thematic groups. The first thematic group are those who are thinking about atypical species, as I just mentioned, camel, pig, cattle. What is the role of these 3 species in the epidemiology of PPR? The ecosystem, how are we able to group countries together? All countries around Somalia, maybe Somalia, Kenya, Djibouti, and Zone 5 of Ethiopia, we can consider them maybe in one single ecosystem. In that case, if we are controlling PPR, we can use the opportunities also to control Rift Valley fever. As I just mentioned, the socioeconomic impact role is to make sure that are we able to assess what is the socioeconomic impact? Because One Health is also to make sure that we have data to convince policymakers that they should invest on One Health, but not investing, because in one of the presentation I saw, yes, we have, if we are doing the vaccination, fair enough, but are we using the vaccine carefully? In the table that I just share with you, there are also many diseases that they should combine with PPR. Among others, there are bacterial diseases where they should use antibiotic. Therefore, are we sure that we are able to control the usage of antibiotic? Then the 4th thematic group is vaccination. How are we able to delineate the disease and zoom the vaccination in that specific area? As I just mentioned, the last one is the wildlife. Therefore, all the winner, around 20 winner of the World Food Program, World Food Forum Transformative Research Challenge, those who have been awarded, all of them, they are scattered around this 5 thematic group. Therefore, their research is any of these 5 topics. But what we can ask is that, why do we need really to support PPR program? Because, and it is more or less the summary of what I was saying, it should be it contribute to better production, because it reduces economic loss for smallholder farmers due to decreased livestock mortality and increased productivity. As I was saying, it's also better nutrition because it improves food security by ensuring stable source of protein. It could be milk, it could be meat, and essential nutrient from healthy small ruminant population. It is the 3rd one is also better environment, promote sustainable agricultural livestock practices, environmental conservation, and biodiversity preservation. Better life, improve rural livelihood through enhanced market access and community capacity building, empowering women and youth in agriculture, fostering gender equality and community development, mitigation of migration pressure for both human and animal population. These are really, why do we try to link the PPR program on the 4 betas of FAO around the agri-food system, because all the four betas are trying to summarize how are we able to work within FAO to support the agri-food system. Then I will finish with this slide that is summarized also of what I was saying, that the bigger picture of PPR, it's true that when looking PPR and One Health, we have to see whether PPR is linked to environmental health, is linked to animal health, is linked to human health. But if we start to environmental health, we have to make sure that it should enabling small ruminant productivity. As I was saying, how are we able to make sure that eradicating PPR, the production will increase? It means if the production increase, it means that there's more meat, there's more milk for children, and meat for all of us, and then even more business or more income. Then the climate. But we know that for all the species that we have, small ruminant is the one contributing less to the climate change. I just mentioned about ecosystem or biodiversity with the tiger population in Mongolia, but as I was saying, reduce antimicrobial usage. How are we making sure that with the PPR eradication, using not PPR but other small ruminant disease, we try to influence on AMR. But in terms of human health, we have the community resilience. We have the female empowerment. Then this is our team of the PPR Secretariat, and you see we have 2 interns already in our team that I'll always call the future of the PPR eradication, Susanna and Jemima. Jemima is connected with us. Maybe she'll intervene. I will give her maybe 2 minutes to share with you her experience as internship. Jemima, can you share your experience with them in 2 minutes? What you benefited from the PPR eradication program till now?
Yeah, sure. If she's here, you can go ahead.
Yes, then it will be maybe the end of my presentation. Yes, Jemima?
Yeah.
Or maybe she moved to another meeting. In any case, take home message, as I was saying, first of all, PPR eradication will contribute to SDGs, but it's also linked to the 4 betas of FAO. And the 4 betas, they are linked to agri-food. It is the 4 more pillars of FAO contributing to food security. If it is contributing to food security, it means that the first one is gender and youth mainstreaming. It tries to empower women so that they have more resources. 2, looking on children, it improves production, therefore producing meat from us, but more milk for children. Then the 4 is more in terms of biodiversity. If we are able to eradicate PPR, we also maybe protect the wildlife society. Small ruminant is also the species that is contributing less in the climate change. Therefore, eradicating PPR, we are also contributing to the climate change. Definitely, the last, it improves food security, nutrition, because it gives income to all of us, and then any other business around the small ruminant population. Thank you.
Yeah, thank you, Felix. It was a very lovely presentation. It was nice to to hear some more background about the PPR disease and also how it not just affects indeed livestock, but also wildlife, the facilitation of the disease transmission, and how everything is connected. Also the strategy to not just eradicate PPR, but also other diseases that you can kind of try to eradicate them at the same time. So I also think it was presentations were very complementary to each other. So I look forward to the discussion. It will be very interesting. We take a break now. I think we take a bit of a longer break, otherwise we have to be back in 2 minutes. So we take a break until 2:15. I think that will be different for a lot of people because of the time zone, but I will put it in the chat, so we will start again in 7 minutes.
Okay, thank you.
Okay, see you. I forgot to mention one thing for those who are not necessarily interested in break or are back earlier. We have a few questions as well you might answer during break through Mentimeter. So I will project them on screen and you can already start answering them. It kind of helps us to facilitate the discussion. Thanks. See you in a bit. Welcome back, everyone. I hope you enjoyed your break. I see some people filled in the Mentimeter as well, for those who were already away. It was just a way to, keep the interaction going during the break and, kind of wrap up the presentations and have something to discuss. I'll remove the QR code because otherwise I can't see. I see a lot of keywords that we actually already discussed in other sessions as well. So it's really nice to see how everything seems to tie together. Indeed, healthy cattle, so they don't form a source of disease either, and also get sick themselves less. Taking the consumer through the whole supply chain. Sustainable farming practices, yes, more extensive. I think it's all connected. Community engagement, very important as well. Integrated disease management. Okay. I'm not sure if to be honest, this is two people. To be honest, I didn't know this was going to happen in Mentimeter. I guess this means that it is categorized in the same in the same department, so to say. But let's go to the discussion. I will share my slides from the discussion. And in the meantime, I invite all the speakers to the screen as well. And then now Marion instead of Fairouz. And we'll discuss all a few questions. And also, of course, participants are more than welcome to engage. I think I already had a few responses in the chat as well. Indeed, about Felix's presentation in underdeveloped nations, that PPR and other diseases pose a very serious threat to food security. And also a good case to underpin that, these diseases do not, even if they don't affect human health directly, they can still be a One Health challenge and affect our health or the environmental health. Indeed, thank you for the presentation. So our first question is, how can the One Health approach be applied to promote sustainable livestock farming practices, so that support food security, minimize environmental impact, and reduce zoonotic disease risks? I don't know who wants to kick off from our speakers, but it's mostly how can we improve these livestock management practices, and if you can provide maybe case studies from your work that achieve this successfully or are in progress of improving these systems.
Yeah. Do you hear me?
Yeah, I do. Go ahead.
Maybe I can start for my colleagues. Thank you for the question. Applying One Health approach is always a solution for the challenge now and as well as for the future. So the One Health encourages that intersectoral or cross-sectoral between different domains. So that will also help us to develop livestock farming practice that simultaneously support food security and as well as minimize the environmental impact and reduce zoonotic disease. For example, when it comes to livestock farming, rational grazing, where livestock are moved between pastures to allow vegetation to regenerate. So that's also a good solution, not only improve soil health, but reduce the need for the chemical fertilizers, but also minimize the risk of parasitic and infectious disease. At that time, or at that gap, breaking the life cycle of the pathogens in the environment. This has been successful implementation in some countries. I can mention New Zealand, so where rotational grazing had led a healthier pasture and reduce methane emission, and as well as fewer cases of gastrointestinal diseases to different animals. So I think I can mention that with that example.
Yeah, it's I think it's a very good example, the rotational grazing of a kind of a One Health approach where you don't even tackle the disease directly, but it's very interesting indeed that it doesn't just help restore the vegetation, but also prevents or at least mitigates these gastrointestinal diseases. So I think that's a very good example. Does one of the other discussers have something to add there, or maybe their own case study? I don't know if Felix and Marion are already back from their break. Let me maybe check.
Yes, I am back. At least in my presentation, I already really shown maybe many concrete examples. In this case, maybe I would have maybe be expecting maybe the winner maybe to have any clarification on this maybe specific issue, because my presentation took into account the food security, the environmental impact. I have shown in my table how the link between PPR, when controlling PPR, we should also maybe try to decrease the incidence of other zoonotic diseases. In addition to that, even PPR itself has, in terms of controlling PPR or maybe all these diseases, we are also maybe try to maybe address the AMI, better use of antibiotic, but even the vaccine itself, because we have to use the right vaccine at the right time. This is what I can add at this stage. Over, back to you.
Yeah. So your the eradication strategy for PPR. So then it, of course, includes the vaccination and maybe empowering women, because in your story it seems, or you tell that they're very important and the livestock is very important for them. So would you call that these are the most important things about your strategy?
Biodiversity, at least we have also, at least we have not only women but also maybe youth, because if I take maybe one concrete example that we had in West Africa, we managed to combine the vaccination against PPR and rabies, because we know that in many countries the young boy, they are the one bringing animal maybe for pasture or maybe for water. But then you use the opportunity not only to vaccinate against PPR, but also vaccinating against rabies. And we know how rabies is a zoonotic disease. It's also disease targeted for eradication, and then but impact even in the new generation. Over.
Yeah, so indeed, like involve the youth. So kind of what you already said about the interns, they're the future of the whole project. And also combine these eradication strategies, which of course you mentioned during your presentation. Does Marion have anything to add? Maybe about the action plan and what strategies are in there to that kind of apply here?
Can you hear me?
Yeah.
I think the concrete examples were given by Aamir and Osman, and Felix, so that's what you really see on the field. But this is what we're working on also in the national action plans that the countries are going to implement. But really, we're trying to make sure that it gets to the level of concrete actions. How can you take it on the livestock production, farming practices? And here's the vaccination, the disease prevention, the applications to follow. Oh, this is I saw that my cattle had this disease and maybe this could go to there. So these are all the prices and the projects the students worked on and presented, the winners of the prize. So I think there they had an answer. But what I can say on that, and that's a little bit of publicity for OLEP and the Quality Impact, is that we're actually working on some case studies that we're hoping to publish on concrete examples on how the One Health approach can be applied to sustainable livestock. So we're hoping to publish that by the end of the year. But one of the things that, and I think you already noticed that we realized on every publication that's already accessible and free of access is that it was always the One Health approach in an anthropocentric manner and not really focusing on livestock. So we're currently working on that, and I'm hoping maybe you can do a follow-up of this webinar when the case study will be published. Thank you.
Interesting to hear, like also including, of course, the different perspectives and like reduce the bias in the One Health approach. So yeah, and then come to a concrete action. I think then we move on to the next statement. Let's see. It's always, there's a bit of delay when I'm going to the next one. Yeah. So of course, the safer livestock systems may require different approaches in all these different regions all over the world. But do you think there's a message that appeals to everyone involved in livestock management? Everywhere that can effectively communicate the importance of livestock health management across diverse contexts? I think this is a very could be a complex question, so I understand it might take some time. I'm also going to check the chat in the meantime. Yeah, indeed. If there are any questions for the speakers, feel free to drop it in here. And then, yeah, of course, the Q&A is integrated, so feel free to drop them. I see. Felix joined the screen.
Yes, maybe I can try to at least the first message in terms of the importance of livestock health management across diverse contexts. Now we have maybe the sexy word is today is climate change. How are we linking animal health to climate change? Many they are being blaming livestock contributing to climate change. What is the role? How the animal health, good livestock management can contribute to climate change? This is the first one. Then we also, I can maybe go back again in my experience, maybe because I am the gender focal point of the division on livestock department in FAO. But I also maybe this really, how are we able to empower women and youth so that they will mainstream gender and youth in sustainable livestock transformation? Then the third one is education. The education that we have within the annual livestock health management can be used for any other sector. Because if we are really able to strengthen vet services, it's not only for veterinary services, but it's also for human public health. Therefore, at this stage, I will really take into account this four statement. Over, back to you.
Yeah. So like the education and of course the involvement of youth and women we talked about, and then indeed climate change I think is such a sexy topic right now, like you said, and it's such a big thing, and it's everywhere in the news. Yeah, people read a lot about it. And then also the bigger one, like the biodiversity crisis together with the climate crisis, and then that story kind of, if you make a story around that concerning livestock health and the One Health approach, that might appeal to people. And yeah, of course, it might also be different. I mean, we say everyone everywhere, but it's of course different when you're talking to a farmer, consumer, someone in the government. It's all, yeah. So I think building a story around that would be very solid. And if someone can formulate that to the point, then that would be very interesting. If there could be a kind of a global message for everyone. Yeah. Oh yeah, go ahead.
Yeah, thank you. I just add, and I agree with my colleague, and I just add one point, which is, yeah, as you know, each country or region has its own cultural and economic context difference. But the united message or the uniform message that it's illegal can be health livestock, means health community, and as well as healthier planet. But this is very simple to say, but it's a powerful message. Regardless of the region, whether we are talking about smallholder farmers in Africa or large in ranches in North America or mixed farming system in Asia, the healthier livestock directly impact food security and as well as our livelihood and our health. The example is, for example, if we emphasize like invest in livestock health management through practice like vaccination campaign, biosecurity measures, and as well as proper nutrition. So that not only boosts the productivity, but also safeguard against some zoonotic disease, and next can be like the pandemics. So we can appeal farmers and policymakers shared interest protecting both the community and as well as economic stability. So that's the message that I can add with the point of my.
Yeah, I think it really nicely connects also to the story around climate change and biodiversity to really get that message out there. Okay, if we have healthy livestock in maybe a more extensive way, so giving them more room, and maybe in the countries that can permit themselves, like where the animal product consumption is quite high, if they can reduce that someday. I know it's something that a lot of governments are concerned with right now in Europe and Northern America, how to reduce, of course, the consumption of animal products, because it's quite high, of course, the consumption of animal protein, and at the same time also feed the global population enough, especially in maybe lower income countries. And I think indeed, if you can do that in a healthy way and keep the livestock healthy, that ties back to the story around the healthy community and the healthy environment. So thank you for that addition. I also see that Fatima responded, great to know FAO's approach towards livestock. Areas where livestock stay in close proximity with their owners should be prioritized as hotspot areas for concern. Yeah, indeed. I think that's what we kind of mentioned that during the introduction, indeed, that so maybe in high income countries, the livestock farming is very intensive. It's one person with a lot of animals. And then on the other hand, maybe in lower income countries, there's less livestock per person, meaning more people come in contact with these livestock. And also there's maybe less measures in place yet. So that's actually one of the statements we're going to discuss as well. I don't know if Marion has something to add to this current statement.
Yeah, well, thanks for adding all the bits of the response for me. So I like the fact that you talked about climate change and biodiversity. I still see that when we talk about the triple planetary crisis, there's still pollution that I feel like, now that I realize even in this conversation, is always missing from this message that's also supposed to appeal to everyone in livestock management. And I'd like us to consider also, and not my like us, I think within FAO we also work on livestock contribution to climate change, not pollution, but it's pollution itself, I'm not sure we can say the livestock is polluting, but it is still contributing to climate change and all. So I think we should also consider that in the programs, the One Health approach, and the right of nature to health itself. So, okay, the more we produce, the more we're going to contribute to climate change, and that's also something we need to consider. It's a circle. So that's one of the things. And I'm sure it appeals to everyone. We see it at the national level. Everybody in livestock management is trying to take that in consideration, climate change also, biodiversity loss, and pollution. However, I'm not sure that's what's ringing a bell when they really want to take action. I feel like one of the things that the governments are raising, and the thing that appeals to them more regarding livestock management, is the economics of it. So sometimes we have to think concretely in terms of implementation, how much it's going to cost them if there's a disease, and try to simulate that so that they see really, okay, this is where we need to invest because otherwise it's going to cost us that. So it's a bit more of a concrete approach, and it's not very sexy, but we need to think of the economics of it in a way.
Yeah, indeed, like you mentioned, the vicious circle as well, like, okay, you're producing a lot, but then you're contributing to climate change, which might decrease the production, and then you start producing more. Yeah, it's interesting to hear about that as well. I think, Jackie mentions as well, the key message is vaccination. How would you address the issue of vaccine hesitancy in low-income regions in livestock health management. That's a very, very interesting one. I think vaccine hesitancy is all over the world, but indeed from livestock perspective, it could be very harmful in low-income regions if you want to prevent diseases as well. But I don't know how you three see that in any of the regions you're working in. Yeah, the economics. So if it would be economically beneficial to vaccinate, indeed. Yeah.
I guess Felix has example with the Deputy Women on how much he convinced them to vaccinate, to work on that. But if you convince them that it's an investment because, oh, you would lose that much if you get this disease, or if you got this one, or if your cattle were to lose all of your animals because of it, then you can see how much it's important, and maybe you can try convincing.
Yes, in addition to that, at least we always take one single example. The cost of one vaccine, the dose of vaccine, is around 5 cents. The cost of vaccinating animal against PPI is around 40 cents. But the cost of one goat is $50 to $100. You invest 40 cents, but you have immunity for life. If not, you lose $100. This small example. In addition to that, in my presentation, I mentioned about the socioeconomic impact of the disease. Per year, we are losing almost $2.1 billion. But do you know the cost of the program from now to 2030 is less than 2 billion. It means that if we are able to invest 2 billion now to eradicate the disease, we will gain 2.1 million times 7, 14 billion. In addition to other value that we have in the animal. Therefore, there are several examples in terms of, it could be the vaccination, it could be also in terms of treatment. Over.
Yeah. Yeah, indeed. And then I don't want to stereotype, but kind of to involve youth and women as well. I think for women, it can also be very effective to kind of, because it's so important for their family and their children. Like, okay, if you vaccinate your livestock against certain diseases, it can also help keep your family healthy, maybe. And indeed provides like, prevent this economic loss from your livestock to, which might even prevent you from sending your kids to school, perhaps. So, yeah. Okay, I think...
I can add this question is really a real life example. A country like Somalia, it's like a livestock dependent country, and people love their livestock. So they don't trust you just to give them a vaccine. But we always try just to convince them more about community engagement, which is, I believe, after doing more community engagement, it's very crucial. And at that time, we just, we are not going just by ourselves. We just try to get some trust local leaders, some veterinarians that are well known in that area, and as well as animal health workers, just to educate and to convince the livestock owners. So at that time, they can understand each other culturally. And that was what we just used it to overcome that barriers.
Yeah, thanks for that addition. And it's kind of earning their trust. Okay, so then we go to the third statement. Oh, sorry, I see we have something in the chat, or is that just a wrap up? I see there's some stuff going on in the chat. Livestock health management is all about human and planet health, indeed. To add a dimension, why can't animal health be a primary outcome? We acknowledge it tends to be how the world approach these matters through the human lens first, of course, because we are humans and we consider ourselves maybe more important, not even by on purpose, but maybe by accident through a bias. So maybe consider livestock also in the way indeed we consider livestock before wild animals first. because livestock have such a more direct kind of benefit to us all. And indeed, livestock health management, it is all about human and planet health of both wild and livestock animals. And then the mobile app for disease reporting is a great tool. Animal diseases have a direct link to food safety. Is it possible to think about a mobile app for reporting food safety risks and foodborne diseases of One Health Advantage? I think that's maybe also about your project, Aamir. So if we maybe if the like some kind of mobile app that you also have for your Rift Valley fever, that maybe it's also beneficial for other diseases, for food safety risks and foodborne diseases. Do you think it could be implemented there as well?
Yes. It's our plan that like to expand this innovation. So after we develop the mobile app, which will be user-friendly mobile app, and it will be available publicly. But the first stage, it will be for Somali language. Later, if we get another grant, then we will improve to, or we will add another language that maybe English second, then Arabic, based on at that time what we found. Yes, but it can be reducible and as well as sustainable. And now what we are thinking is after we develop the Rift Valley one, we just wanted to move to trypanosomiasis, which is a deadliest disease in some African countries. And when it comes to Somalia, trypanosoma is the first disease that prioritized the Ministry of Livestock as a zoonotic disease. Although the sleeping sickness is not here, but it can be a problem if it starts, because the vector or the set fly is there. But what we are missing only is the parasite. So our next project is just to expand the mobile app to trypanosomiasis, and as well as it can be applicable to another places as well as another diseases. So it's very easy when we have the idea first time successfully completed, then we can duplicate or we can reproduce more.
Yeah, so kind of the same strategy could be repeated indeed for more kinds of diseases, whether foodborne or not. So yeah, let's go to the next statement. How do consumer perceptions and concerns about livestock health influence these purchasing decisions, and what are the implications for the industry? I think this also really differs between regions. Maybe some people can kind of afford to be worried about how was the livestock treated, was the livestock happy, or how were they kept, and other people are more concerned with how do I feed myself. So I think this is also very context dependent, but I don't know how you see this in your area of work.
If I may, I can maybe take the area of Osman from Somalia. Somalia or the Horn of Africa, they are producing small rumina or maybe livestock in general. First, for their local consumption, it means that the perception are different. Even reaching the Horn of Africa, the perception of even the slaughtering of animals in Kenya is different from Somalia, because there is the process of slaughtering the animal for Muslim countries. Then even the live animal should be, if the animal is earmarked, the impact or maybe the price can even vary from Somalia to Kenya. This is even reaching the Horn of Africa. But in any case, looking Somalia, Kenya, and the Horn of Africa in Middle East, almost 5 million small rumina are exported from the Horn of Africa to Middle East for religious purposes every year. And there's the quality, the message, the quality of the animal need to be known by the traders, because it's the need of the importer. What kind of small rumina are you bringing to Middle East? Therefore, the message is different between country, or maybe according to the religion, or even according to the what will be the end value of this animal. Again, if you take even again in the gender purpose, in Somalia, camel is the property, camel and cattle are property of men, but small ruminant and poultry is for women. Therefore, the message, if you are bringing the message for this group of people, or even for species, you have to model and try to say, okay, if it is for small ruminant, I will be targeting women, but if it's for large animal, I will be targeting men. But in any case, the industry, being in Somalia or in Middle East. Few years ago, I'm linking with Osman, he tells us, when I was working in that region almost more than 20 years ago, they were concerned of infecting Middle East with Rift Valley fever. And they were banned in 1996, 1998 against all small ruminant population from Somalia to Middle East. But how we bypass it? We try to make sure that we will not be exporting the live animal anymore from Somalia to Middle East, but the slaughter animal in Somalia according to the Muslim rule, and then exporting. You see, it means that we try to model the industry, the needs of the importer or the country in Middle East based on the requirement, religious requirement. But if that animal was supposed to be sent to Kenya or to Uganda, we will have not, the message will be different. This may be a few examples that I can share with you. Over.
Yeah. Yeah, I think that's also a very nice development, like instead of transporting live animals to already slaughter them in the country and like prevent having to, have a boat or something with all these animals very close together. Also more potential for spreading diseases. So I think that's a very good development. And also, this perception of slaughtering differs between cultures and religions. So it's good to take that into account, but not necessarily have to export the animals, but just export, maybe their meats or other products, produced in the way that the country you're exporting to, stands by. So, I think that's also kind of what you say, like with the small ruminants for the women.
Or maybe if you want, I can take example of Europe. Instead of Africa. Even Europe, if I take the Parmigiano Reggiano, who is the cheese that is more, at least is the one costing the highest cost cheese around the world. But how it is produced, even within Italy, in northern Italy, it's not, you are not able to produce the same kind of cheese in middle Italy. When you start moving through to Netherlands or even Switzerland next door, the quality of the milk will be different because maybe you will use this milk or for cheese or drinking. Yeah. Therefore, you see, and then even the meat, the quality of the meat, or when you are looking even in terms of eggs, you will see that few eggs, they are more yellow, or those are they are white. Why? It's because of the nutrition. What kind of how are we feeding these animals? And the purpose, we feed them based on the market. Because spaghetti, when you look at the spaghetti, they are using eggs, but the quality of the eggs that they will use for Barilla is different from Spazzini or I don't know any other. Therefore, even in Europe, in Africa, in America, the message should be different because based on the industry that you are targeting. Over, back to you.
Yeah. So now we have worldwide examples, basically. Thank you. Yeah. I think it's go ahead.
Yeah, I will elaborate with that. Like the man owns the live animal, but the woman owns the product from the animal, such as cheese, even if it's milk or egg, that all owned by the woman. And I will also want to add one point, which is But nowadays, many consumers, they are more aware than previously about issue like antibiotics. And as well as some, they are more aware about animal welfare and the risk of zoonotic diseases. So that could lead them just to prefer or to choose a product that are labeled as organic, antibiotic-free, or ethically sourced. For example, yesterday afternoon, we had a discussion about zoonotic diseases. So a participant expressed her concern about using antibiotic just for herself. She afraid like AMR or to get AMR. She's a medical background. She now like how this affect her body. So she decided not to use antibiotics. So, but she was unaware that AMR could also develop from consuming animal products. So when the presenters or the panelists explain how animals product meat like milk can also a part of AMR transmission to human. So that also another problem that could question about whether switching alternative, like she was also asking about what she's going to do because she is more afraid about AMR. She said like what I'm going to do, whether switching to alternative like canned foods or another safer option like to go with carbohydrates. So this also reflects the growing consumer uncertainty and demand for guidance making a healthier choice. It's really a life example for. I think you are mute. You need to unmute yourself.
Thanks. Yeah. So indeed, yeah, I think it's a very good example also of how this like training and knowledge spreading can really increase the awareness of people like for welfare, but also, yeah, the product they are consuming. So I think we will wrap up with one last question from the chat. Let's see. Ikomiari says, how is the, okay, so this is specifically an FAO question, but it could also be applied maybe to your project, Aamir. But how does it utilize international health regulations core capacities to advance the One Health strategic plan and enhance accountability for member states? I think that's also a very good one, because of course you can make up all these regulations and rules, but if there's no accountability, then there will be no pressure to adhere to them. So I don't know if someone can aim or try to answer that question.
I may start. Or Felix, you want? Can I start and then complete?
Mariam, do you want to, please?
Okay, so I chair international health regulations. So what we do with the quadripartite, and I'm going to give a concrete example within FAO, is that we use this evaluation of international health regulations. So there are several ones between WOHA, WHO, and FAO. So there's the joint external evaluation. There's something called the Performance Veterinary Service from WOHA. So PVASDE, all these acronyms that we love in the United Nations. And we kind of summarize all those scores, and we look into details of those scoring. And we try to identify what's missing at the country level, at the national level, always in cooperation with the governments and the national teams, so that we see, okay, this is the results you got from the GE, this is the results you got from the AHR National Project Workshop or PBS, and this, in all the scores, every time this bit was missing and this bit was missing. And when it comes back in several scores, this is where we identify some priorities of actions to implement the National One Health Action Plan, for example. So we had, for example, in Kenya, we had some workshops where the quadripartite worked with the government and the FAO local national team. And we studied all the scorings, and with the platform, the One Health platform that's in place in Kenya, we decided, okay, according to all the scoring, this is the priority. This is where we would like to focus us as the Kenyan government. That's what they told us. And then we support them to how to say that? Yeah, So they identify those priorities after the summary of all the scorings, and then we support them. Okay, this is the priority you want to implement. This is where we can help you technically, and maybe this is the entity you should reach out to if you want some funding, if you need some advancement. That's also where we can support as well. Felix, would you like to add?
I think that from my end, I think that you really summarize linking it to, in any case, the international health regulation is international, it's for all of us. Therefore, there's nobody, we are obliged to implement it because it is also for our health. Over.
Yeah, thanks for concluding. Thanks for answering the question and already also concluding our event with that, because I think, yeah, that was the last statement and question we can discuss today to keep within time. So thanks a lot to our speakers for all of your time. I will now have a short feedback session to kind of wrap up today. So yeah, big thank you. I really enjoyed the discussion. So to kind of reflect on today's key questions, you can already see the bias towards the human perspective here, because our thing was, okay, what is the relationship between these drivers and what is the impact on public health? So that's the human perspective, but we also discussed like the impact on environmental health and animal health. So I think it's very good that we kind of try to take away that human perspective here as well. And also we discussed all these drivers, I think, and all these different systems. So differing between genders, between regions, between animal species, whether they're wild or livestock. So I think we covered these questions more or less. Today was actually our last public event, and the next event will just be specifically for our cohort to catch up and update each other on progress. So I really enjoyed our webinar series, and I will upload the recording of these as well for you to all look back. And of those who agree with sharing the slides, we will share the slides as well. So I think we covered most of the questions. I will quickly check the chats. Oh yeah, that's just Marion adding to the question that upon request from the government, the QTP can support by studying all the scorings to identify priorities on action, and then we support for the implementation. Okay, so I think we discussed everything. I really enjoyed it. I think I've said it a few times right now, but I really did. I really loved your enthusiasm and contribution to the discussion as well. So yeah, see you next time to our cohort, but unfortunately for the rest, this will conclude our series for now. Yeah, thank you all for joining, whether this was the first session you were in or not, but yeah, hope to see you another time.
Okay,
Bye-bye.
thank you.
Thank you, bye.
Bye.